Today we will demonstrate the extraoral advanced fulcrums. You can see on my hand, I have my instrument placed securely in the back of the hand, fingers apart onto my instrument, and I'm resting on my middle finger here. The rest of the fingers are against the side of the cheek, hence a knuckle buckle. I will retract, and I may fulcrum lower or I may fulcrum higher on the mouth. Be sure to fulcrum your mirror as well. Then we may begin rocking off your fulcrum as we explore around the tooth. You will see that the thumb slowly rolls with each stroke as you maneuver around, but the wrist and the large muscle groups are doing all of the work. The next fulcrum I will show you is your basic chin cup fulcrum. Here again, I have a nice C shape, my instrument set back firmly in my hand. My adjustments here, these two fingers will be my fulcrum on the side of the cheek. As you see, I am not touching the cheek with my hand palm. It is just that direction. It's a nice cup. So as I go intraorally, I will use my mirror to reflect light, and I will fulcrum off of these, keeping everything together, and I may rock off my fulcrum using my large muscle groups as I roll around the tooth. Here again, you will see the thumb roll slightly as we maneuver around the tooth, but the large muscle groups again are doing all of the work. No finger pulling. The next fulcrum I will show you is a finger on finger for the maxillary right quadrant. I will insert my index finger into the vestibule, come around with my hand grasp, looking at where my instrument is placed in my hand. This finger, middle finger, is a little farther forward as I sit it on top of the other finger. And you can see I have gained some length from the occlusal plane to the finger, so I may fulcrum. My instrument moves closer into my middle knuckle instead of back farther to get angulation. And then I may instrument on the distal surface, keeping my fingers separated at all times. They don't touch, the index and thumb, and then roll this direction and work your way around, having the large muscle groups do all the work for you. Next, I will show you the maxillary left finger on finger fulcrum. I've moved my position to the 8 to 9 o'clock position, had my patients turn slightly away from me, index finger of non-dominant hands placed up in the vestibule. Maintain your grasp of a nice, good, solid C shape. Fulcrum finger on the non-dominant finger. I've got my length again, and you may start to explore or scale those areas, rotating and having your thumb and your large muscle group do the work for you as you roll around. The wrist is moving forward, so you're rocking close to their ears as you go, maintaining your grasp. To do the mandibular right quadrant, you will move your clock position to 12 o'clock, 1 o'clock time zone, non-dominant hand into the vestibule, dominant hand placed finger on finger, reaching down into the vestibule to scale. For your basic finger assist, we will be using your lingual aspect, chin cup, extraoral fulcrum. My non-dominant finger will be placed on the terminal shank of the instrument for the distal surface. These fingers need to touch your other hand to keep as a unit. Finger pressure going up for our finger assist, and this pressure up to assist the hand as you rock off. For the finger assist on the mesial surface, The pressure of the opposite hand will again be on the terminal shank, and the thumb will be touching the opposite hand, so you may work as a unit. You place the instrument on the mesial line angle, add your pressure, add your unit, and then you can begin to explore around the tooth, rocking off your fulcrum with the pressure going down onto the mesial. For the anterior buccal, place your thumb into the vestibule, and then your index finger again gets placed on the shank, usually higher on the shank versus the terminal shank, so that you may see what you're doing better. Pressure going against the tooth as you work a horizontal stroke, rocking off the fulcrum with an extraoral fulcrum on the cheek, moving opposite direction, 12 o'clock position. For the lingual aspect of the lower anteriors, sit at the 8 to 9 position, fulcrum on the facial surface of the lower teeth, insert at the line angle, index finger, lateral pressure against the tooth, thumb on the other thumb for a unit, then horizontal stroking across the tooth with the horizontal stroke. For an opposite arch fulcrum on the mandibular right lingual, you will fulcrum on the maxillary arch, retract the tongue, reach down to the mesial or the distal surface, and scale or explore your tooth. For a cross arch fulcrum, you need to be past the midline. So if I'm going to fulcrum on the lower right lingual, I will fulcrum on the lower left lingual occlusal plane, reach across to the lingual plane, and explore opposite arch, sitting at my 8 to 9 o'clock position.